It is very important to wash your hands thoroughly before handling feeding devices. For continuous feeding, fill the feeding bag with the prescribed amount of formula. Purge the air from the tube by filling the catheter-tip syringe with water and attaching it to the silicone Y-port. Open the right-angle feeding set clamp and pre-fill the tube with water. Close the clamp when the water reaches the right-angle adapter. Slip the Christmas tree adapter of the feeding bag tube into the feeding port of the right-angle feed set. To prevent premature disconnects, Applied Medical Technology offers an optional silicone clamp to secure the Christmas tree adapter to the feeding port. Ask your local healthcare provider for details. Remove the safety plug from the Mini Balloon Button feeding port and attach the right-angle feeding set. To attach the feed set to the Mini Balloon Button, line up the black mark on the feeding set adapter with the black mark on the button. Make sure the feeding set adapter is pushed in completely and gently turn clockwise at least 1/2 turn, but no more than 3/4 turn. The adapter will run into a stop when it reaches the 3/4 point. Do not attempt to rotate the adapter past the 3/4 stop, as this may damage it over time. If the adapter does not rotate freely when first inserted, make sure the adapter is pushed in fully and that there is no debris blocking the feeding port. Adjust the pump settings according to the manufacturer's instructions. You are now ready to unclamp the right-angle feeding tube and begin feeding. When the feeding bag is nearly empty, add the prescribed amount of water. Once the formula and water have been administered, stop the pump, clamp the feeding tube, and disconnect the feeding bag. Fill the catheter-tip syringe with 5 cc's warm water for children or 10 to 20 cc's warm water for adults. Unclamp the tube and flush it with warm water until it is clear of formula. Remove the right-angle feeding set by rotating counterclockwise until the black marks are realigned and gently disconnect it. Then, insert the Mini Balloon Button safety plug into the feeding port. It is recommended that the patient be kept with his or her head elevated for at least 30 minutes after feeding. If medications need to be administered, they must be in liquid form. Diluting thick liquid when possible will help prevent the Mini Balloon Button tube from becoming clogged. If a medication is only available as a tablet or capsule, check with the pharmacist or physician to make sure it can be crushed and dissolved in water. Be sure to flush the tubing and mini button with warm water after each dose of medication.